will turn it over to our presenters. Thank you.
Thank you. Welcome. Good morning, good afternoon to all of you out there. And welcome to our Mental Health Emergency Planning in Rural Communities presentation. I am Maya Santa Maria, the Executive Director of the Northwest Georgia Center for Independent Living in Rome, Georgia. Also presenting today will be Kathy Baker. She is our program manager, and one of the many hats she wears is that of Guru of Emergency Preparedness. In addition, we have Jill Baldwin, who is our project manager, and one of her many hats is that of our AT and IT specialist. She has designed what I think is this gorgeous website, and in a moment you will hear from them. We have a mission statement. Yes, thank you, Jill. Our mission statement is to empower people who have disabilities so that they may choose and determine their own future, and to work towards a more user-friendly, accessible community. We are located in Northwest Georgia, northwest of Atlanta, bordered by Alabama and Tennessee. There is a map on this slide, and that's about as best as I can do to describe that, as I'm blind. But I can also tell you the counties, which are Bartow, Catoosa, Chattooga, Dade, Fannin, and Floyd, Gilmer, Gordon, Haralson, Murray, Paulding, Pickens, Polk, Walker, and Whitfield. We have a saying in our office, because we are a small center serving a lot of people, and that is a paraphrase of a couple of phrases from various military leaders throughout time. And that is, just a few of us can do a lot for a lot of people on a very little. Now, don't tell our funders about that last part, because gosh, we all need funding and we don't want them to think we're miracle workers, because we're not. Every September, we hold some type of event to recognize emergency preparedness and planning. Typically, these events include such things as roundtables with our first responders and consumers so that they can exchange information. Sometimes we have put on classes for CPR for people who have disabilities. Sometimes we have done demonstrations of self-defense. We have also participated in emergency personnel's various fairs and community education events. Several years ago, but see, all of these all pertain to concrete things people can do to prepare for an emergency. Well, several years ago in our community, our governor closed Northwest Georgia Regional Hospital, our mental health hospital. That sounds great on paper, but the reality was there were no community supports in place. There are still very few. We began seeing a lot of people who ended up in jail, who were unhoused, and we saw a community that was very confused, overwhelmed, and afraid. So we took it upon ourselves, seeing that great need in our community, to focus even more strongly on that underserved, unserved population of people. We have created presentations and educational courses for people who are returning citizens. We work with the different shelters in the community. We work with people who have substance use issues. It's definitely been something that at least we've had a little head start with, because now enter COVID. And COVID, as I think most people have begun to really realize, affects people who already have mental health and emotional issues more deeply, more severely. And even those people who consider themselves mentally stable have realized they are dealing with issues of isolation, change, and depression. So this year, we decided to focus our emergency preparedness on mental health and emergency planning and dealing with something that is very long-term and detrimental to our mental health in COVID. So we actually ran this program customized to our community last month, and we are so grateful and so excited that April has accepted this workshop for this great conference. I'm now turning the presentation over to my incredible team with Jill and Kathy. Thank you.
Thank you. Okay. Hi, my name is Kathy Baker, and I am going to go on and read this first screen for you. It is objectives for this presentation. So we're going to review the history of pandemics and how it relates to today, to COVID. We're going to learn how to put together your own disaster go bag. You'll receive info and resources on making your own disaster plans. I want you to understand and learn how to map your neighborhood and learn how mental health issues interact with disasters and emergencies. So ultimately, we hope to help you mitigate and thrive from the effects of a disaster.
Hi everyone, I'm Jill Baldwin. I'm the project manager at Northwest Georgia SIL. I am a white woman with pale complexion. I have shoulder-length light brown hair, and I'm wearing a black shirt and black cardigan because all of my clothes are black and covered in cat hair. So a few words on pandemics of yore. I would like to describe the images that are on the screen. First, you'll notice that we have a background image. This is the Kleinman Low Nebula. This was taken by Hubble using infrared. It is a swirly mixture of dark reds, beige, and light blue shifting to dark blue. Also on the screen is a colorized copper engraving from the 14th century. In the middle of this street, it's a close quarters street. There's a brazier burning. There is a person in a robe with a bell and lantern in their hand and a red hood. And there are various people sitting with their faces in their hands, looking very sad. And all of the buildings around them have a red inscription that reads, "Ye Lord, have mercy on this house," and a red cross. The Black Plague of the 1300s that decimated Europe has been attributed to fleas carried by mice and humans. Estimations for the damage caused by the bubonic plague are difficult. However, historians put the number of deaths between 75 and 200 million in the years 1346 to 1353. The bubonic plague caused pandemics again in the 17th century and for a third time in the 19th century.
So here we have it. We see the Red Cross. That came later in our history, but Red Cross has been in a position to help with all of these kinds of things, these disasters throughout history. We've tracked them, we've studied them, and we hope to mitigate them with vaccines, with treatments, sometimes in hospitals, sometimes not. Okay.
And now we'll talk about a lasting gift, public health measures from the Black Plague. We have another colorized copper engraving on this slide. This is an engraving of Dr. Schnabel. This was done in the 17th century. This was an actual plague doctor. He's wearing a long black robe with shoes, gloves, a wide-brimmed black hat, and he has the iconic plague doctor mask, which almost looks like a bird's beak. You can even see a leather gasket between his mask and robe. This seals him completely, or as well as they knew at the time, from any diseases that he is interacting with. So the first public health measure we're talking about are medical inspections. Plague doctors made visits to homes and other living spaces to confirm suspected cases, who then were isolated in their homes.
It looks like he's got on the first hazmat suit. If I were going into a home dressed like that, I would probably scare the citizens, especially with that beak.
Next, we talk about the isolation of people who were sick in plague hospitals. These hospitals became known as fever hospitals and remained in use until the 1900s. Today, isolation is done more on an individual room basis when possible.
It's the same principle that they developed back in those days, that we needed to keep people separated away from each other, people that were infected and people that weren't. They just went about it a little bit differently.
We move on to restricting ships to port. Venetian authorities first isolated ships to port for 30 days, then extended the period to 40. This is where we get the word quarantine.
Ships were a big traveling disaster in those days because they were carriers of the mice and rats that could have caused the plague.
And lastly, we look at controlling the movement of people and goods. Municipal authorities soon learned this was a key way to control the spread of infection.
And that's pretty much what we do today. We say we need to isolate, we need to wear masks, we need to stay 6 feet apart. So we're not doing anything differently from what they did do.
The image on the screen is a modern day photograph. It is a concrete wall. Inset in the wall is a smaller archway. And then within that is a very small wooden door, suspiciously maybe the size of maybe a wine glass, maybe.
I had to put that in there. I thought it was appropriate, of course, for this time of the year anyway, but yes, they managed to have their own drive-ins. So this is what that was. They would pass glasses of wine or bowls of food or loaves of bread through these small openings, and they were considered isolated and insulated from anybody that was carrying the disease. This is my slide, okay? I have been a go bag person for many years, and my go bag changes from disaster to disaster, I guess. But the basic needs that you have in a go kit, which is to me a backpack. So I have some water. I have some of the freeze-dried space food. I have a crank radio and a flashlight. Well, it's actually together, so I don't have to worry about it. And I can crank it up and have light too. I do have a small first aid kit in there with a whistle to signal for help. I have a dust mask, towelettes to maintain hygiene, a wrench, and a hammer. Actually, I had to expand on that. A can opener for food. because if I get stuck in a pandemic like we are in now, and I don't have a can opener, with my pantry loaded with the canned goods I've got, I'd starve to death. And then local maps. And local maps are important because if you don't have access to your GPS or your iPhone or internet, then you are just kind of out of luck. So you want to make sure that in your go bag, you've got some of all of that. Okay.
So the image from that previous slide comes from FEMA's website, which is ready.gov/plan. FEMA has you covered. You can find emergency and disaster plans for a wide variety of scenarios and geared towards a very diverse population, even your pets. The image on the screen is a small beige cat resting on a soft beige blanket, and she has one of FEMA's small checklist brochures propped up against her. And this is my kitty. Her name is Karma, and she's always prepared. So be like Karma.
Karma will probably make an appearance pretty soon.
More than likely.
An important part of my go bag, of course, is planning for my animals. I have 2 cats and a husky. And so I have to have water for them. I have to have a way to deliver water to them. I also have a way to get some food to them and make sure that they're safe and taken care of. I do have a tether in my car so that the husky can't just bound around like he is used to in the house. And that makes it work for us. The cats are not too happy when they get slammed into a crate, but that, you know, that's part of life anyway. So they pretty much rule the house, and I love them. I don't know what I'd do without them, especially at this time, because they have been a big help to my mental health. Also, the FEMA website can tell you some tips and tricks for having a disability and having to prepare for what you might do if you don't see well, or if you don't hear well, or if you are not mobile or active. You can get some good tips and pointers through FEMA. For seniors, it's important that we keep up with our medications, and there are a whole checklist of things like that for seniors on this ready.gov site.
And this is actually timely for me. I live obviously in Northwest Georgia. I live out in the woods. I joke that I have steam-powered internet out here. So if you lose me, that's why. But we actually had a tornado warning out here over the weekend. And it was, I think, detected about maybe half a mile away. It was very close to our house. This is, unfortunately, a somewhat common occurrence out here. And we have 2 cats inside and the dog outside. And one of our cats, not Karma, the other cat, Kiva, still is not happy about the dog coming into the house when that happens. So my husband went to one of our safe places in the house, which is a closet with the dog, and I went in the other closet with the cats. And it was just best to keep them separated at that point. But I always make sure I've got all my supplies wherever we go to shelter for all of them.
Oh.
So we're going to get into the Map Your Neighborhood program. First, I'd like to say that this was developed by Dr. Luann K. Johnson. We're using this with permission from the Washington State Emergency Management. This is an excellent tool, and we are very happy to be able to share this with you. So in emergencies and disasters, your neighbors are your closest source for help, and for them, you are their source of help. Before disaster strikes, know who and what is around you. And you can find the Map Your Neighborhood resource booklet at transitionus.org And the longer link is on the screen. I'm sure this will be in the recording and maybe someone can pop it in the chat window. But if you just start at transitionus.org, then you can find your way to the Map Your Neighborhood tool.
This is a great little booklet to be able to just have on hand. It's got one page that says, okay. And then it's got another page that says help. And in between those two pages are checklists of things you need to have on hand if you have to shelter in place. There are ways that you can communicate with your neighbors. It's got a list for you to put your neighbors in. This is one of the things. When we had a tree fall on our house a couple of years ago, it was like, who's got a chainsaw? You know, the neighbor across the street from us said, I've got coffee made. Those were such big things for us to have offered to us at that time. We had just moved in and we weren't here even 6 months, I don't think, when the tree fell on us. So we didn't really know a lot of people around, but everybody kind of pulled together in this neighborhood and helped us out.
And I'm in a different situation than Kathy is. As I said, I'm out in rural Northwest Georgia, and my neighbor is actually my dad. We have about 18 acres out here on a little homestead, and we have more family that's closer with more. And we obviously take care of each other, not just in disasters, but on a day-to-day basis. So I know where things are out here, and there's not much. There's no food delivery, and I just kind of have to hope that we've got all our supplies here. Thankfully, my dad is what you would probably call a prepper, and he would find that a compliment. And he has lots of things stockpiled, so I know that if he needs something, he's got it. And I know that if he needs me or my husband, we're over here too. So it's a different situation. I've mapped my neighborhood. It's just mostly trees and squirrels and coyotes.
But you know who's around you and what to do in case there is an emergency, and that's important.
Very true.
So, now we come to a little, question and answer time.
Yep, yes. A little rest stop here.
All right, thank you, Kathy and Jill. Wonderful presentation so far, enjoying it. At this time, our presenters would like to offer a Q&A session for their first part of the presentation. So I'd invite any attendees who have a question to please drop it in the Q&A. They will be hosting another Q&A session at the end of their presentation. If you have any questions now, they're happy to answer.
And just remember too, if you want to raise your hand and speak with your microphone, you can press *9 if you're on the keypad or the phone, or press this raise hand option on your menu bar. We have a couple comments with participants who have tried accessing the link to the Map Your Neighborhood resource, and it seems to not be working at this time.
I'll make sure to get the correct link to the April staff so that it's on their website. They can put it in the resources that they need. You can just do a Google search for Map Your Neighborhood, and you should get maybe a couple of mirrored sites for the PDF of the Map Your Neighborhood booklet. I also want to let you know that it is a big booklet, and if you go to print it out, be aware it's several pages and there are color images in it, so you may need to adjust for that. But we'll get that link to you. Sorry about that.
Wonderful. Thanks so much, Jill. Appreciate that. There's a question that says, Medicaid doesn't allow extra meds for go bags. Any ideas?
When we had a tornado come through here in Rome, Georgia at one time, there was a lot of displaced people. So what happened was we would go to the pharmacies and say, look, this is the medication I'm on. And hopefully your pharmacy was still standing after this tornado. If it wasn't, like, if you use Walmart or someplace like that, they can also access records for your local pharmacy. So what you do is you go to the pharmacy and you say, look, this is what's happened, and I have had this big disaster, whether it's a house fire or a tornado or a hurricane or a flood. Go to the nearest local pharmacy and say, these are my medications that I cannot get a hold of.
Thanks so much, Kathy. Looks like we have one more question in the chat box. What is the best method to communicate to rural consumers this information when internet may not be available? This is great information for our consumers, especially with the winter months approaching. Thank you.
What we've done in the past with our center before COVID was I would take a presentation like this out to people where my go bag is with me, maybe my shirt bag where I've got the little helmet and the utility tools and things like that to show and tell. I think most people in your communities are going to respond better to seeing the actual physical presence of something like this. So my suggestion would be, if you want to take it out on the road, take it out on the road. Let them see this. When the internet's down, we shouldn't all be lost. We shouldn't all be lost. We should be able to take care of ourselves, like with the medicine. And that's what the next part of this is going to be about, is how you can do that. But if you're ready and you're prepared and you have a plan in place, then hopefully you can carry on your daily living without too much disruption.
I'd also recommend, for reaching your consumers, for those who can access information via reading or a printout, the best time to have this information is not when disaster happens, it's before. So maybe if you or your center has the resources to create a mailer or a packet to send this information out ahead of time, then that might be a good idea, and maybe some instructions on where to keep it so they can have it easy to hand. I don't know if that's something that's possible for you in your center or your folks.
Excellent advice, Kathy and Jill. Thank you. A couple more questions coming in here. Any natural and healthy items, such as essential oils, that might be recommended for anxiety during disasters that can be safely stored?
Well,
and then the participants recognizing this might not be an area of your expertise.
I'm going to go on and say I want my lavender oil, but I also want my fuzzy blankets. And the biggest thing that I can do to prepare is to make sure that me and my animals are safe. So as long as I'm prepared for something like that, then that relieves a lot of my stress.
Looks like someone else mentioned lavender in the chat, so good advice. When we have floods in some places, let me start that over. When we had floods, some places did not let service dogs in. What do you say to those places?
I would say to get out and advocate in your community for the fact that, and this has come up here in Rome. We had a house, it was an apartment fire, and we had to set up a shelter, and it ended up being in a church that was really progressive about animals, and we were allowed to have some animals in, but a lady that was not going to leave her burnout apartment was not going to leave her dogs there. And of course, we all stepped up to the plate. We got crates, we got pads, we got everything that we needed. Plus, she was a diabetic, so we had to get her some insulin. This is Red Cross doing this, okay? So talk to your Red Cross, talk to your EMAs, talk to your FEMA FEMA has people that can talk to you one-on-one about things like that. Most shelters, and I'm going to say this, most shelters should allow animals, and if they don't, there's probably a reason why. So if you want to, make a conversation, start a conversation with them about, well, these are service dogs. They've got to go with me. This is what happens if I don't have my service dog around me. Talk to the community people that are setting up a shelter. I think you'll have a better dialogue with them than you might think.
And at the heart of it, the ADA allows service animals in that situation. And the shelter and the people there may not know that. So unfortunately, it might be on you to give them some education about what the ADA says in that time, but the ADA does allow for that.
All right.
This is my
one last question. Oh,
I'm sorry. I just wanted to add to that just a minute. We also, those of us who use service dogs in our area, we have identification on them that also connects to an emergency person, just like you carry your own emergency contact. And if, heaven forbid, a shelter just won't take you, and that's your choice, only place to go. If you can contact somebody, have that arranged in advance, contact somebody who will take your service animal in and help you advocate on your behalf. During a crisis, you may end up somewhere without, but if you can get that animal back to you in a day or two because of a friend or a family member, that's a start.
I joined the Red Cross. This is Kathy, I'm sorry. I joined the Red Cross in 2005 when Katrina hit because I had some outlaws down in Louisiana. So one of my tasks was to go around just Floyd County here where we live and see who might be agreeable to having shelters. And when it came time to talk to whoever was in a position to say, yes, come on into my church, come on into this building, this community center, that would always come up in my discussions. And I wanted to make it very clear that sometimes people will not leave their pets, even if they're in a hazardous situation themselves. They will not leave their pets behind. A service dog is not a pet. It is an absolute part of you, and you have to have it. That's why I would encourage anybody to go on and talk to their community people, their EMAs, anybody that would be able to say, okay, we need to take this under advisement. Okay.
We have one question on the phone. Okay, so if you want to go ahead and press *6 to unmute, you can go ahead and join.
Hi, I just love lavender, and I wish I could have it around me, but I'm real violently asthmatic, and I know there are other people with, various chemical sensitivities and whatnot that can't go into even hospitals or anything because of the hand sanitization chemicals that are usually fragranced in people's perfume and whatnot. And I wonder if it would be appropriate to suggest that when the Red Cross or anybody is doing drives in the community and asking for personal care products and things, if they could make it a point to ask for things that are fragrance-free, or if it would be better if those of us who are super allergic try to ask for different rooms for ourselves or something like that in the shelter.
If you, yes, when you approach somebody at your Red Cross, your emergency management agency there, the locals, yes, absolutely, bring that up. Bring it up to your fire department. A lot of times that they go out, they're not looking at, they're not understanding that. So if you can tell them, hey, I've got this problem, I can't deal with this, or something, lights, noise, smells, things like that. You know, they can be, they're trained to be sensitive to these kinds of things.
Do you think that it would be out of line to ask other people in, say, a shelter or something to not use fragrances?
No, no. I think if you are able to advocate for yourself in that situation, you know, in an emergency, might not be the best time to consider being polite and being nice, and instead advocating for your needs if you feel comfortable doing so, obviously.
And when we say advocating, we mean in a polite way, you know. I know there's been times when I've been in enclosed environments and I couldn't stand somebody's perfume, and maybe I just have to leave. But sometimes I can foreshorten that and say, look, if y'all don't mind, don't wear chemicals, don't wear strong deodorants or strong detergents or perfumes, aftershave, things like that, and know that I have to act in a polite way, that it doesn't happen.
All right. We have additional questions coming through. We make sure that you have to get through the remaining presentation, and it looks like the questions would apply to go over. So we will to have time for the remainder of your presentation. So we'll turn it back over to you, Jill and Kathy. Okay,
thank you.
Thank you so much. Thank you, everybody, for your questions. My goodness, this is the dialogue and everything is just wonderful. I didn't expect so much. So thank you. So moving right along, I want to go ahead and put out a content notice regarding trauma and domestic violence. The remaining discussion for this presentation involves the topics of trauma in times prior, during, and after emergencies and disasters, including the potential for domestic violence. Please make your decisions accordingly, and if you need to leave, we completely understand. Do what you need to do to take care of yourself. So now we're going to get to the meat of it, which is how emergencies and disasters affect mental health. And we'll be doing this discussion in 3 phases. Our first phase is before disaster. Some emergencies and disasters have warnings leading up to the event. This can lead to anxiety, panic, reliving past trauma, or other effects. For events that do not have warning, the dramatic shift from before to after disaster can be the catalyst for trauma responses.
When somebody experiences a disaster, the first thing you think about is, where am I going to stay? What am I going to do? Whatever the first thing that you think about is. If you've already made plans for it, of course, you know what you've got to do. You'll know which way you have to walk out the door, okay, is what I call it. So when we had the tree fall on our house, like, we knew that there was going to be a windstorm that day, And sure enough, it was a 60-mile-an-hour downburst. And the little tree that fell on the house fell all the way across the house. My daughter was getting ready for work. I was getting ready for work. My granddaughter was in the living room watching TV that morning. And when I had to call and tell my coworkers that a tree had fallen on my house, I don't think it sank in that it was a tree and not a branch. Okay. And after everything that I had done to be prepared for it, there was still that disbelief. And I'm kind of going to avoid this, I can't absorb it. I can't take it in right now. That is usually the first sign that you are going to have some kind of problem later on out of a disaster. So just be aware of that.
So one of my non-apparent disabilities is panic disorder and obsessive compulsive disorder. And I know that some of my OCD rituals may get me stuck in a loop and they may do more harm than good. But I know that there are some that actually calm me and help me get a hold of myself in the situation and make good, decisive decisions. One of the things that I'm absolutely most terrified of are tornadoes because I can't control what's going on, right? So I focus on controlling what I can, which is the environment around me, my home, my family, my animals, which are family, obviously. And I focus on that, but I know that my anxiety is going to kick in immediately when I hear the words tornado watch, and it's going to go into overdrive when I hear tornado warning. And that happens several times a year where we live. So I know what to expect. I've got that planned for myself. And my husband does as well. He's so wonderful about being very understanding of my anxiety and my OCD rituals. So in the interest of time, I think I'm going to go ahead and move on to the next slide. We're getting down to the wire here, it seems.
Uh-oh. Sorry.
So during disaster, panic and confusion often occur. Paranoia and delusions can prevent someone from seeking help from others and authorities. Isolation often begins in the midst of the event, and executive functioning difficulties also impact how someone goes through the event.
So what happens then is your mind just kind of shuts down. It really, it kind of numbs you to the fact that a tree has fallen on the house, and what should I do? My neighbors came out of their houses when they heard it and felt it because it was a pretty big tree after all. And, like I said, the lady across the street, she offered us coffee. The lady on the other side of us wanted to make sure that we were okay. An ambulance got there just as fast as they could. Nobody was hurt, thank God, but an ambulance was there just as fast as they could be and were checking us out. When a disaster like that occurs, and there were several outbreaks around that same time, and a lot of trees came down then. But I'm thinking about another time a couple of years before that when we had a tornado come through a little small town a little farther away from us, and a lady that was deaf was in her trailer, and she was in her trailer for 3 days before they found her, and did not know that her uncle that was in the trailer next to her had passed away. And so these are things that can happen, and when a disaster strikes, if you're not ready for it, it is very confusing. It's panic time.
And I'd like to add in the point about paranoia and delusions can prevent some from seeking help from others and authorities. there are a wide variety of mental illnesses that can involve paranoia and delusion that even before a disaster can keep someone from accessing services that they may need simply because of the symptoms of those mental illnesses. So, you know, be aware of that. If that's something that affects you, again, like we've said this whole time, preparation is the key. Get ready now, don't get ready then. And like I tell everybody at the office, especially when it comes to audits, if you stay ready, you ain't got to get ready. So just keep that in mind. And lastly, just a few thoughts about after the disaster. Isolation can grow due to separation from supports. Financial and material loss can compound any effects of the disaster. Fear, anger, frustration, and more can lead to domestic violence, substance use, and others.
I know we've seen the effects of isolation, probably up close and personal. And by the way, kudos to any of the parents out there that had to homeschool their kids for a little while or a long time. I got that pleasure with my granddaughter, and it was traumatizing for me. Let me tell you. I do live alone. I have a 2-bedroom, 1-bath house, and like I said, I have the 2 cats and 1 dog. I don't have to worry about somebody being domestically violent to me. However, I do have the worry that somebody could come through the front door that I might not be ready for. This separation thing has really, and I've got to admit, it really has gotten to me. I love people. I love to be out, and I have been so totally isolated and separated from family and friends and co-workers and friends that it's been hard. It's really been hard. I did take and this is one thing that's come up for me that's been good. Online training. I did take a psychological first aid course. It was provided by Coursera. It's Coursera. And it was through Johns Hopkins University. Dr. Keltner was the one that had presented it. It was 5 sessions long. I really would encourage anybody that could, that wanted to take it because it was really a good one. It goes from, let me put it like that. It goes from how you can help somebody to how you help yourself in a bad situation. So if you do the active listening, if you do the planning and the preparation stages, then you can help somebody else and you can help yourself. One of the things that I did get from the training was the incredible amount of substance abuse that has gone on since we started this COVID thing. And one of the things that really struck me as I couldn't get my head around it was that people are abusing energy drinks. And so I don't do energy drinks and I don't know what the thrill is. And I just couldn't get my head around that. But that course really, really laid out in a 1, 2, 3 manner what it's like to be able to help someone. And like I said, when you can help someone else, you can help yourself.
So the emergency or disaster event can become a mental health crisis in and of itself. And when it does, we need new ways to mitigate this disaster within a disaster, such as mental health advanced directives, a written or pre-formulated crisis plan, and a mental health go bag. I have a lot of experience helping people develop both crisis plans and mental health advance directives. I'm a tremendous advocate for mental health advance directives and crisis plans. I have literally seen them save people's lives. And I don't say that lightly. And I myself have plans like this in place. You can find advanced directives on NAMI's website, NAMI, and we've got a link for that coming up. And again, in the interest of time, I think I saw a question about what goes in a mental health go bag. So I'm going to go ahead and push on, and we can cover that here at the end. So the unifying theme is be prepared. The moments before a disaster strikes are not the time to make a plan. That time is now. And here's how. So we have a few links on the screen. We have FEMA's link, which is ready.gov, tons of websites there, great stuff. SAMHSA, substance abuse and mental health. And I've forgotten the acronym. My dyslexia is playing tricks on me today. That's not kind. As well as NAMI, like I said, the National Alliance on Mental Illness, and NOAA for weather-related disasters. Kathy, I see in the chat window, you may not be able to see this. We have someone, Susan is asking, can you repeat the name of that John Hopkins course, please?
Yeah, psychological first aid.
It's a great one.
Yeah.
It really is. So I'll leave these links up for just a few more moments. And again, it'll be in the recording. And our contact information for our center is at the bottom. You can find mine and Kathy's direct information there. My email address is jbaldwin@nwgacil.org. And Kathy's is the same, except it's kbaker@nwgacil.org. And I'm going to stick those in the chat window as well. And I think we have a few more minutes left for questions. Thank you, everyone, so much. I've really enjoyed this. This is great.
Well, thanks again, Jill and Kathy. Am I coming through okay?
Yep, you're clear.
There we go.
Okay.
Sorry about that.
Oh, no. I know I was staticky last time, so thank you. We do have a couple of questions in the chat box again. Do you have a plan for the deaf? There's hardly anything available for them. So any suggestions there for Stacy?
Oh yeah, there are so many things that can help. We live in the county that has the School for the Deaf for the state of Georgia. And so we have had a CERT class that graduated with 18 people that were deaf, hard of hearing, that are certified CERT, which is, Community Emergency Response Team members. So there were 18 folks that are deaf, hard of hearing that were able to pass that course. It's wonderful. It's wonderful. Get in touch with me, please. Jill gave you my email address, and I would love to be able to do this one-on-one, okay?
Thanks, Kathy. We have another Kathy participant who asked or states that she lives in Cedar Rapids, Iowa. In the aftermath of Derecho, I'm not sure if I said that right, we had 4 apartment buildings that were disability communities. These buildings have 2+ floors. With no power, people with disabilities and those who use mobility devices were literally stuck for 2 weeks or more.
Oh my gosh.
Ideas for working with local officials so this does not occur again.
There are ways that you can prepare for that. If you prepare early enough for that kind of thing. Back when Sandy came through in New York, was it Long Island? Anyway, back when Sandy came through, there were people that were on ventilators, actually living out in the community on ventilators that had no power. And what they did to survive was just incredible. But you learn before that disaster.
I would suggest taking the situation directly to your emergency management in that area if you have access to those officials, and give them, not anecdotes, because this is more than anecdotes. These are our lives, not anecdotes. But give them the stories from what happened and say, hey, this is what happened and these are the issues that we ran into. What can we do to help you? What can you do to help us? And again, be prepared. I'm so sorry that happened. That had to be absolutely horrifying.
The biggest thing you're going to find when you start into emergency preparation is if you don't take care of yourself, you can't take care of somebody else. So however much or little that you can capture and assimilate, do that. Start with yourself first, then you can help others.
Wonderful, thank you. I'm not seeing any open questions currently. I do just want to remind participants that this wonderful presentation and all the pertinent materials will be available on the April conference website after today's presentation. So you can go back and review all of the information shared today. And also, I think this is when Sierra will make the plug for the end of the session evaluations. Those are very important for your presenters and for April in providing that feedback.
So yes, once we leave the room today, you'll get the automatic evaluation. And I did see somebody's hand was going up and down. Please just make a note of their emails and please contact Jill or Kathy to ask any more questions that maybe you couldn't think of at the moment or you come up later. So thank you all for joining today.
Thank you for having us.
Thank you, everybody. Have a great rest of your day. And remember, if you stay ready, you ain't got to get ready.
Thank you, Jill.
Thank you. That was great.